How you treat an enlarged liver depends on the cause. Successful treatment first involves identifying the underlying condition. Among the most common causes of an enlarged liver are the following. Cirrhosis occurs when scar tissue replaces healthy liver tissue. Treating cirrhosis not only requires determining the cause, but also the extent of scarring. The immediate goal is to slow the progress of damage. In many cases, excessive alcohol use is the root cause of cirrhosis. Fatty liver disease is a condition in which fat builds up in the liver to the point at which liver function can be compromised. Alcoholic fatty liver disease occurs due to alcohol use and heavy drinking. Treatment requires limiting or avoiding alcoholic beverages, managing your cholesterol and blood sugar, and reducing your intake of saturated fats. Non-alcoholic fatty liver disease is also a condition in which fat accumulates in the liver, but not because of too much alcohol use. Your doctor will recommend losing weight, changing your diet, and exercising. Avoiding certain foods while adding others to your eating habits also helps. Various forms of hepatitis are also major causes of liver damage. Hepatitis B and C are treated with prescription drugs. Bed rest and avoiding alcohol can help relieve symptoms. Individuals with hepatitis A and E usually get well without treatment after a few weeks. Liver cancer requires a detailed treatment plan that takes many factors into consideration. These factors include the stage or extent of the cancer, the overall health of the patient, the likelihood of curing the disease, extending life, or simply relieving symptoms as much as possible. Liver cysts are fluid-filled pockets that grow in the liver. No treatment is needed unless the cysts grow large enough to cause symptoms like abdominal pain, fullness, or bloating. The most effective treatment for liver cysts is surgically removing the cyst using a laparoscope. Various gallbladder conditions or a bile duct obstruction can also contribute to an enlarged liver. Bile ducts carry bile, a digestive fluid, from the liver to the intestine via the gallbladder. Treatment involves identifying the cause of the obstruction and fixing it. Obstructions often result from gallstones that move into the bile duct and block it. Frequently, doctors recommend surgically removing the gallbladder to prevent the growth of gallstones in the future. An enlarged liver can also result from congestive heart problems. In such cases, a wide range of treatments and lifestyle changes may be appropriate to bring the liver back to normal size. These treatments and changes are beyond the scope of this video, but are covered in more detail elsewhere on this channel.